Hello, myself Mohammad Riza Ahmed and I belongs to group number 466 and I am a fourth year medical student of Astana Medical University. So today my topic is in OC about the auscultations of the heart. So in the auscultation of the heart, firstly we'll introduce with the patients, and after that we'll not use any kind of medical term. We'll just simply will say that we are going to listening the heart sounds. So now I am going to doing the auscultations in that patient. So firstly, in the from the mid clavicular lines, we will count the 5 intercostal ribs. 1, 2, 3, 4, 5. So in this point there is located the mitral valve, so we will hear. After hearing the mitral valve sounds, this sound is normal, and from the right side we'll count 2 intercostal ribs, 1, 2, and behind the sternum we will here located the pulmonary valve, aortic valve, sorry. So in the aortic valve we'll hear normal heartbeat, and in this point in the left side from this from the clavicles we'll count 3 ribs, 1, 2 and 3. Here is located the pulmonary valve. So in the pulmonary valve we'll hear the sounds, and from the clavicles behind the sternum, at the end of the sternum, will in the fourth intercostal ribs we'll hear the tricuspid valve sound. So from the pulmonary valve to the tricuspid valve, between this point, one point is there. So this point is called Botkin point. Now I shown about the auscultation of the heart. So thank you for listening.